my name is Carrie Van Weeren, and I'm going to be presenting to you about medication errors. What is medication errors? Well, medical errors refers to an error of omission or commission at any step along the pathway that begins when a clinician prescribes a medication and ends when the patient receives the medication. A preventable adverse drug effect is a result from any medication error that reaches the patient and causes any degree of harm. It is estimated that about half of the adverse drug effects are preventable. A potential adverse drug effect are medication errors that do not cause any harm, either because they are intercepted before reaching the patient or just because of luck. An ameliorable adverse drug effect is one where the patient experienced harm from the medication, while not completely preventable, could have been mitigated if different actions or procedures had been followed. Adverse drug effects account for nearly 700,000 emergency room visits a year, account for nearly 100,000 hospitalizations, and nearly 5% of hospitalized patients experience an adverse drug effect. There was a study done in 2011 and posted on clinicaladvisor.com about a hospital that was doing a study that stated that more medical errors were reported if the process was anonymous, and more errors were reported if the employee was not punished. In the 30 months after the program was put in place, 216 medical errors were reported, as opposed to just 5 the year before. As part of this program, the patient safety team met regularly to discuss causes and solutions to the medical error problem. It is shown that asking healthcare professionals to voluntarily report errors with no fear of punishment was effective in improving error reporting and solutions to errors. According to the Institute of Medicine, more than 7,000 deaths are reported due to medication errors. Some strategies to prevent errors are patient wristbands with barcodes. As a patient enters the hospital, they receive a wristband with a barcode on it. On that barcode has information about the patient and the medications that they are receiving. Nurses then scan medications and they scan the wristband, and if an error is reported, then a warning will pop up. Another strategy is to minimize name confusion between drugs that have similar names. The FDA has a computerized program that will detect similar sounding names. They also track errors with these medications and then can go ahead and spread the word to other healthcare agencies that this is a problem. Standardized drug facts have also been put on over-the-counter medications, and this helps consumers better select medications and follow instructions. Other strategies are through the hospital setting is pharmacy intervention, and this is what happens when a patient is ready to come in for surgery. Several days before, a pharmacy technician will call them and go over their medications. A pharmacist will then review these medications and present it to the doctor, and then the doctor will then go ahead and decide which medications will be continued and which one will be stopped before the procedure. Also, computerized physicians' order entries. This makes sure that medications are not misconstrued because the physician has bad handwriting, or there was a decimal point in the wrong spot, or a wrong abbreviation. Medical error statistics. In 2008, medical errors cost the U.S. over $19 billion. $17 billion were directly associated with additional medical costs. Additional costs of $1.4 billion were attributed to increased mortality rates. 10 million days of lost productivity from missed work based on short-term disability claims because of medical errors.
Hello, my name is Ben Nagraki, and I'll be talking about the democratic style for leadership styles. To address the complex healthcare issue, medical errors or near misses, it requires a combination of leadership styles. The first I'll be discussing is democratic. The leader involves group participation by encouraging the team to speak up and join in the decision-making process. They promote autonomy and growth in individual employees. These leadership characteristics are a perfect combination to address medical errors. This issue requires a team effort and collaboration with other entities. They are also important in this growing issue. Teamwork is essential to a health system in which all employees are working for the good of the goal to reduce these errors and who work together to achieve this goal. By including employees with collaboration between physicians, nurses, and other healthcare professionals will only increase team members' awareness of each other's type of knowledge, skills, leading to continued improvement of this issue in decision making. Employees are also given their own responsibilities, and this promotes autonomy, making the employee feeling valued. Continuing on democratic leadership style, this then makes employees more prone to make a needed change and encourages them to participate in improving quality of care by decreasing these medical error incidents. This type of leadership is considered to be a relational leadership style. Relationships are important to this leader. This style is considered to be related to both positive nurse and patient outcomes because the leader creates positive relationships within the organization. This is a highly effective leadership style because employees are more likely to put forth more effort to assist and change this evolving issue when they feel valued. Only through reporting these errors can nurses and other healthcare providers learn which system design and operational failures contribute to these errors and subsequently improve the quality of care. Criticism is needed at times through this changing and ongoing process, but it is useful and productive. Open communication is important and makes employees feel that their voices matter. They are more than concerned about the issue and how it affects healthcare and know that they can influence the changes needed to improve the issue. Focus on quality improvement of organization systems and processes and less on individual mistakes. By eliminating a punitive culture and instead encouraging a culture of safety will only cause employees to increase their error reporting. And that's my part.
Hi, my name is Sandra Ratliff. I'm going to present to you the transformational leadership style. As Ben has already mentioned, this evolving issue of medical errors and near misses within our healthcare systems require changes, and in doing so, requires a combination of leadership styles, as he has discussed democratic. I will be discussing the transformational. The main trait of this leadership style includes an inspiring nurse leader who encourages team involvement and uses their individual creativity and innovation to transform their staff to accomplishing the goals within an organization. With positive motivation that these leaders provide to their team, they are providing inspiration that can motivate them to perform beyond expectations. This style is leadership by example. When staff see their behaviors, they are more inspired to make changes and for the better, and they no longer put themselves first. They instead place more importance on what is best for the organization. Old ideas and traditions are questioned, and newer ideas in solving this complex for resolving these complex issues are more effective and encouraged. Transformational leadership has been shown to be a positive contributor to a safer climate and has also been associated with lower staff turnover rates and other leadership styles. This leadership style has also been linked to a reduction in medication errors in a majority of studies, according to the article that I referenced in this slide presentation, retrieved from Bradley University in 2016 on how nursing leadership styles can impact patient outcomes and organizational performance. This leadership encourages team building and collaboration. This creates trust and respect amongst the staff. Transformational leaders are energetic and do the right things for the right reasons. They treat people with care and compassion. They encourage their staff to be more creative and innovative and inspire others with their vision. They then instill these levels of higher morals and ideas to their staff. This form of leadership has also been linked to lower patient mortality rates, a positive contributor to a safer climate within the hospital, and nurses were much more in favor of this leadership style approach because it promotes self-motivation and job satisfaction in comparison to other leadership styles. This was also retrieved from the Bradley University in 2016 article, How Nursing Leadership Styles Can Impact Patient Outcomes and Organizational Performance. In conclusion, effective clinical practice in reducing these medical errors and near misses must encourage and implement these leadership styles discussed in this presentation. And by making these changes, healthcare organizations have a great opportunity to greatly enhance their clinical outcomes. Thank you, and that concludes our presentation.